So this is the best part of our conference, in that people who work in the field, who do research, who do community service, who are members of the recovery community, kind of get together and network, I guess that's the term for it, and actually make connections in a way that unfortunately we don't always have as much opportunity to do. So we're really grateful for the opportunity to create this opportunity for everyone. And I think that's one of the original purposes of DCARE back in the day, to kind of serve as to use Zev's term, a hub for all that's happening in the greater Upper Valley and states of Vermont and New Hampshire and beyond. So we're really grateful that you all are here. Afternoon on a Friday is tough, right? To hold energy, to hold attention. And I know people start to fade right after food, and then at this time of the day, some of us who are a little older start to fade, period. So I think I'm really excited that the schedule included Dr. Sara Lord at the end, because Sara brings an incredible amount of energy to the table. She's an assistant professor of psychiatry and pediatrics here at Dartmouth. She's the director of the implementation core of the Center for Technology and Behavioral Health. She's a clinical and developmental psychologist by training, with really, it's actually been a theme of the four presenters this afternoon, a strong commitment to reaching the hard to reach, the marginalized members of our society. In Sara's case, youth, people with HIV, and of course people with drug use disorders. Sara is one of the few people who can actually say she's from here. She grew up in Norwich and is a Hanover High School graduate, Middlebury College undergraduate, so you don't have to...
But I did leave.
Right. That enhances your credibility, actually. So, implementation science, actually a short acronym, IS, is a relatively new discipline, still in its infancy. Has a whole host of new other acronyms that those of us doing work in implementation research have come to learn and to just roll out of our tongues without really consideration of others. But some of the things that implementation researchers talk about, I think the three previous presenters addressed, like what is it going to take for consumers to actually use these devices, to use the phones and the tools that we develop? What is it going to take, and what kind of providers are going to be necessary to support the delivery of these things? So I think Zev had a little workforce, workflow aspect to the intervention. What kind of people are going to have to do that? How much of their time is going to be involved? And then, again, the organizations that are presumably going to be the places where a lot of these things are used, and there's going to be leaders, and what are the leaders going to think, and what are the supervisors of the clinicians going to think, and what are the doctors and the nurses and the office managers? How are they all going to work together within the context of a team and an organization and a healthcare neighborhood to make these things actually work? And then lastly, and I think this is huge, what are the economics? Who's going to pay for this? And is it going to be affordable? And do we give people phones, or do they use their phones? Do we say, okay, you can have that app for $19.95 and it's good for 6 months? Or does your Cigna Healthcare cover that cost for you? So the workforce, the workflow, the leadership, the economics of implementing these tools are huge. And I think that today you've heard a lot about development, efficacy, and effectiveness research. What Sara is really dedicated to is implementation research. So Sara, we're really excited that you're here and are going to drive us home.
Thanks, everyone. Wow, this is a diehard crowd on a Friday afternoon at 3:10. Thanks, Mark. You really laid the groundwork for what I was hoping to just present as the to seed the conversation, because I think at this point we've had a lot of presentations and a lot of things to think about. So really what my goal is to think about, well, you can build these things and you can test them and you can get really, really good results in pretty controlled situations. And it can work, and then you can say, okay, yeah, we're ready, you know. But unfortunately, it's not that easy, and you can't just build it and they come flocking to it. So I was hoping to just present a bit today about, so what are the factors that influence readiness for and successful implementation of technologies. To provide a little bit of a conceptual framework for this, I want to take us back to the diffusion of innovations model with Rogers, and Rogers was a rural sociologist, and he really did the seminal work on diffusion and adoption of innovations from he started looking at farming and using the innovations of different farming equipment and different kinds of seeds and plantings, and then he looked at innovations in medicine and engineering and business. So he really is the founder of sort of this conceptual model that we'll be describing today. He also coined the terms around sort of early adopters to innovations, and then sort of folks that kind of then go along the bandwagon and start using things, as well as then late adopters. Sometimes they talk about laggards, and those are the folks that you really have to work hard to bring them on board. But that's okay, because it's all part of a process. A number of people have sort of built upon the diffusion of innovations model. The one that I'm going to present today is Lord Damschroeder's, which is the Consolidated Framework for Implementation Research. She sort of built her model around health services, which is why I will talk about that one in particular. And all of these models really think about implementation, adoption and implementation from a place of thinking about characteristics of the innovation itself, thinking about characteristics of the contexts within which we actually are trying to use in this case, these technologies, both the organizational context, but also the policy and political context that what factors in those contexts influence our use. How do potential end users, consumers, how do they feel about technologies? And also when we talk about potential end users, of course, it's not just consumers, it's providers, and it's any other stakeholders in an organization. And then the implementation process. So what do we think about in terms of innovation characteristics? The model really presents things like, characteristics of innovations that tend to promote implementation are whether you can demonstrate really, is there a clear advantage, a relative advantage? So is there a clear advantage of this solution over other alternative solutions or current practice? Is the technology, in this case as the innovation, is it compatible? Does it fit with the audience, the end user audiences, and the needs of an organization? Is it adaptable? Can you readily sort of fix it and tailor it to meet local needs? How easy is it to use? Ease of use is a very important characteristic. Can you try it? How easy is it to actually use it in particular settings? And related to that is how easy is it to observe the outcomes from these trials? So technology solutions really, just by virtue of being technology, really can inherently meet many of these criteria. And we've talked about that here throughout the day in terms of the relative advantage of delivery, fidelity, reach, standardization, data collection, the different kinds of, I think it's important to think about the different kinds of technologies that were presented here today and how they fit with the end user audiences. So there may be certain audiences for whom serious games hit the sweet spot. There are certain audiences for whom IVR is the best simple phone is the best methodology. And I think one point that has been sort of alluded to, but I wanted to emphasize is that really the technology should fill the need. As opposed to, there's a lot of sexy technology out there, and so we're kind of driven to be like, okay, what more could I add to make this even cooler? But simple is often the best. And so I just caution folks to not, to really let needs drive technology and how you use it. Technologies are also really easy to trial. You can take some apps and you can put it in your system and try it and look at the outcomes. So I think an important part of the innovation characteristics of these technology innovations, which has also been alluded to here, is really the user-centered design approach, so that you're involving your end users, and that means your clients. That means clients and providers and leadership folks and payment decision makers right from the outset in terms of identifying a need and then figuring out how technology can actually address that need. That's going to help with engagement and implementation in the long haul. So what are the characteristics of organizations or settings that we think about in terms of optimizing implementation, or that we want to study? I mean, I think going back here, for each of in each of these domains, they present tremendous opportunity for research, for how we can study these technologies, but also in terms of implementation, in terms of the messages that we create to convince our stakeholders around relative advantage, and this is how this technology can fit in your particular agency, and why don't you give this a try? And here are the results here are some results that show that it works. So what are characteristics of the inner setting we should think about? One is the social networks and sort of the communication network that you might want to engage as you're trying to build some awareness around technologies. Are there inherent networks within organizations that you can sort of use to seed information about technologies and to build a buzz, if you will, about them? What's the implementation climate of a given organization? What really their capacity for change, and is there a shared vision among stakeholders about the need for this technology and how it might be used? And if there's not a capacity for change, then that's a target then for implementation or intervention. So when we think about implementation climate, we think about, is there internal tension or motivation for change? Are clients saying we need something different? Are staff saying, we could improve processes here? Is there a history of innovation? So questions around how has change been introduced into organizations in the past, and how has that gone? How has it been measured? Are people using other kinds of technologies within a system, like telemedicine or video conferencing? Just something that you could sort of grab onto to sort of build a narrative around introducing other technologies into the system. Again, compatibility or fit with the norms and the workflows, so really having a good sense of, what is the current workflow in an organization, and how could technologies actually be worked into this workflow, if you will. So strategies around that. How do you build a shared perception of importance of implementation around the innovation? Are there incentives? If you want to try to implement an innovation within a primary care setting, are there incentives for providers to actually promote the technology with their clients, either in terms of tangible kinds of things like awards or promotions, or intangible sorts of things like stature or respect? And another sort of internal climate metric is the extent to which goals are clearly communicated, so and acted upon and fed back to stakeholders. So you may have somebody in a leadership position, for example, at your organization who says you must use this technology. That might go over initially with providers, but probably won't be as so effective in the long run. So really thinking about ways to promote a shared sense of goals and communication, and a learning environment around which to teach stakeholders, build awareness and knowledge among stakeholders. And then another sort of characteristic is how ready is the setting for implementation. Is leadership engaged? What's it going to take to get leadership engaged in using a technology? Are there available resources to support whatever your technology might be, and how information is transferred, and how easy is access to information and knowledge about the innovation? So is training available? Is there ready technical assistance? Things we think about from the external context, when you're thinking about implementing a technology, is what kind of policy things or regulations are going on that might influence a decision to adopt and implement. So in that way, we think about, are there networks? How embedded is a given organization within a network of organizations, so that you might use that broadened, diverse network to promote a technology? Is there sort of competitive pressure between agencies or between organizations around, that group down in Concord is using this technology, maybe we should be using it up here in Lebanon? Is there any press around that? For technologies in particular, there are some, and we've talked about this throughout the day, external policies and incentives. The Affordable Care Act provides lots of motivation and maybe some stress or tension around being able to, how do we provide services to meet the demand? The High Tech Act provides technology incentives to FQHCs to build their technology infrastructure and use technology. The Parity Act really drives some emphasis on parity of medical care and behavioral health care. So we think about sort of what are the regs coming down, or are there external boards that are providing some press to change and to implement a technology in this case. What about individual end user characteristics? What are important factors that would influence implementation? And that way we think about knowledge that folks have about technologies and using technologies, the beliefs they have about technologies. Will technology sort of get in the way of traditional care? Do they have a belief around technology being, boundaryless and sort of impairing sort of the boundaries between clinicians and clients? Do folks have self-efficacy? Are they confident about using these different technologies? So when you have present somebody with a mobile app, is the training done in such a way that you can build confidence about using it? Are folks just in general, that the folks that you're trying to kind of introduce technologies to, are they open to change? How flexible are they around changing process? The fifth dimension of this consolidated framework really speaks to the process of implementation. And so I'll go through just a bit of these four areas. One is around planning and preparation for an implementation. So thinking about, as Mark sort of described the groundwork, thinking about, well, if you want to introduce a technology into your primary care setting or your outpatient treatment setting, how might this technology influence workforce? And how might you need to sort of prepare workforce, change workforce, train workforce for the introduction of this technology? How about in terms of workflow? How does workflow, ideally you want to introduce these technologies in such a way that they are streamlined with workflow. If you ask folks if there's any sort of perception that it's going to create more work for providers or anybody in the organization, that is likely not going to be helpful for adoption and implementation. What kinds of resources are necessary within to support this the integration of technology? Another sort of really important factor is really understanding from the get-go, from the beginning, having some sort of plan around how are you going to measure success of the introduction or use of a technology within a system. And how are you going to provide feedback to your different stakeholders about that, in terms of in order to build buy-in, you need to be able to convince people that what you're introducing is actually going to make their job better or make things better. So that could be by making their job easier. That could be by improving client outcomes. That could be by reducing costs. What's important to different stakeholders may vary depending on who the stakeholders are. So for leadership kinds of folks, the messages around metrics of success might be around the cost efficiencies. For provider folks, messages about success might be around workflow, being able to focus skills on the highest level of expertise, being able to focus on sort of more difficult caseload, difficult aspects of cases, and for improving client outcome. The other important part of this process is really engaging everyone and building buy-in within the organization. So that means really identifying folks that can kind of help cheerlead this effort through a system. And there are different kinds of sort of cheerleaders in this way. There are the opinion leaders, and they tend to be sort of the folks, they may not be driving the change, but they are folks that have, that people look to sort of, they're kind of maybe trendsetters. So if they decide not to use the technology, if the sort of people with a lot of sort of opinion power decide not to use your technology, that's probably not a good thing. So identifying sort of who are your opinion leaders and really being able to then bring them into the process of implementation is really important. Identifying folks in a environment that can actually lead the change and lead implementation and integration of this technology within a system. These can be the champions also that are sort of cheerleading. They may not have the logistic responsibilities of making the change, but they're the champions and they're the cheerleaders, and they can sort of be your main marketers for getting a technology integrated within a system. And then really another important element of this process of integrating technology and related to successful integration and implementation is really identifying external change agents that can really help to provide technical assistance and consultation around integrating a technology into a system. So in our case, we think about those partnerships between the developers and the researchers, and that can really provide the training and the consultation and expertise to help address some questions as they come up. So then we think about executing, you're planning and engaging and then actually implementing. And then the fourth point, reflecting and evaluating as part of this process, really reiterates what I mentioned around the planning, is actually collecting the data around your implementation success. So when we think about that, maybe the penetration, how many people you reached, how acceptable did they like the technology, and being able to then provide that feedback, as I mentioned, back to your stakeholders. It's so quiet. I really want to ask questions as we're going, but we'll keep going. So I'll keep going, and then we'll get to that place. But I just I thought I'd present just some of the work that we've done in terms of it's the end of the day, and it's Friday, and some of the work we've done in terms of looking at readiness to implement technologies. The first I'll describe is we partnered with the National Council for Behavioral Health, and this is a network of community behavioral health care agencies across the country. And we created an online survey that we distributed to their clinical decision-making leadership, really with an idea to just get a pulse on, how ready are folks to use technology-based solutions to care. We created this survey based on the Organizational Readiness for Change out of the Texas Christian University. And it included things like organizational flexibility, pressures for change, attitudes about technology, the things I really based on the characteristics I've described from the CFR model as well. So we were looking at technology readiness in terms of supporting it, how much do you perceive a value to using technology, and how committed are you to using it. Not surprisingly, these are just, the things that we thought would be associated with readiness, like a flexible organization was. Both internal and external pressures for change were both positively related to readiness. Not surprisingly, concerns about privacy. The more people had concerns about privacy, the less ready they were to, the less they endorsed readiness. We asked just how, in a single item, how ready are you to meet the service demands of the healthcare reform? And that's actually that single item, which is not good psychometrics, he's doing that, but that single item was actually quite strongly related to their readiness for technology, as was current technology use. Interestingly, not a lot of folks, we had about 450 organizations that we had data from, about just shy of about a third of them use some form of telehealth or video conferencing, but nobody was using anything for, like we're talking about in terms of web-based programs or apps or anything like that. The most likely uses of technology I indicate here. They were more likely, so we gave them this was from a list, and they just checked off, how would you be likely to use technology approaches. So you'll see in the green, they were more likely to endorse using technology for training purposes, for reminders, scheduling and appointment reminders, illness education and wellness interventions, somewhat around ongoing symptom tracking. What was interesting is they were least likely to endorse the things that we've actually been talking about here, such as brief interventions and treatment and some crisis intervention work. So I just think that means we have a lot of work to do to let our audiences know the potential of these kind of technology-based tools that folks have been describing here today. We also gathered at the end of this survey just an open-ended question around what do you see as the perceived barriers to using technologies? And so just to summarize, how am I doing for time? Okay, just to summarize a bit, not surprisingly, funding came up, which was actually the greatest barrier. Privacy issues of privacy and security were quite, or something we definitely need to address before folks are gonna hop on the bandwagon with a lot of these technologies. The need for knowledge and skill building and awareness about what kind of programs are out there, we have no idea, and how do we get them? So while I don't have any suggestions, I don't have solutions for that, beyond just like we need to get the word out about these programs. And sadly, probably not just in academic journals, which is the academic journals are really important in terms of disseminating among researchers and policy folks about results, but we need to put those results in digestible language that people can understand, so that we can build awareness in that way, and use other forms of dissemination as well as journals. Concerns about equipment and infrastructure, just attitudes about using technologies, that it's going to build a mistrust. We can't use it. It's going to get in the way of our relationship. It's going to create unhealthy boundaries. Providers, for these on-demand, reach your clinician at any point in time. Clinicians are not so excited about that because that actually can create a liability, as well as nobody wants to be on call all the time. So thinking about strategies around that. Accessibility, and while we've talked about the growth of technology, I think we need to also acknowledge that accessibility for many, and particularly for smartphones, is still is still a bit of a challenge. And so while that 5 years down the road things may be different, right now, there's a substantial minority, I would say, that don't have smartphones, and it may be more a majority. It's more a majority for some subpopulations. Connectivity, I don't know if anybody's tried to connect here in Hanover or Lebanon, but we don't even have connectivity here at Dartmouth College all the time. So really there's a lot of infrastructure work that needs to be done about building connectivity and really dealing with these issues around billing and reimbursement. These policy issues, they need to be addressed in order for folks to really feel like they can embrace these kinds of models in care. So I imagine I'm not going to go through how we're going to, the potential solutions, because I think potentially that's a good conversation that we can all have together in our discussion, if that's okay. Okay. And that's how you can reach me.